A 336 area code. Who's this? Where you calling from?
Yeah, this is Yabba Dabba Doo, Yodel He Who from Chitty Chitty Bang Bang Beep Beep Boop.
All right. Very well. And what is on your mind?
I think I know that area.
Well, so go ahead and say first time, long time.
Of course, I recognize
this call.
the handle.
This call is, you're gonna be upset with me.
Okay.
I'm gonna say some things that you're not gonna like. I'm gonna say some things that, you'll like, whatever. I'm getting over a very, very bad case of COVID.
Oy.
Very bad. Lost 9 pounds in 3.5 days.
Oh, jeez.
Yeah. So, pretty rough. I got a big, big dose of COVID. Like, I know how I got it. I know.
How did you get it?
So I've been being very, very careful. I'm basically still living like it's, I don't know, June 2020. Like,
okay.
I don't really see many people.
Okay.
When I go out, I wear an N95. If I am around people, it's like I haven't been around more than 2 people in a long time at a time. But
okay.
So basically, had somebody over for dinner. Expressed to this person how careful I was being. Let them, asked all the questions. It turned out that they had been having what they thought were allergies for about a week, and neglected to tell me about it. They spent the night, and I got a lot of COVID. A lot.
Okay.
So, I'm not vaccinated. We'll talk about that if you'll allow me to.
Okay.
And so I'll start by saying a couple weeks before I got COVID, which I contracted COVID on 17th of September. 2 weeks before that, I was in an emergency room for 16 hours for a different issue. It was basically like being in a scene from an apocalypse. It was terrible. It's just human suffering on full display all over the place.
Can you tell us where you're located? Just
region of the U.S. if you don't even want to say which state.
Yeah, I'll say. I just really don't like. You guys are going to want to yell at me eventually. So.
All right. Well, that's fine. But we will yell at the state. But what state were you in?
Okay. It's Central North Carolina.
Okay. All right. So you were in the ICU. You were in the emergency room. It was a disaster. Was there a lot of COVID in there, or was it just like being in an emergency room is a difficult proposition?
Well, for sure, there were at least 4 COVID positive people in there. They had they had like a glass room built where they put people once you test positive or you have a positive test when you come in.
Okay.
They put you in this room. 3 of the people, when I got there, were already confirmed positive. They were in that room. There was one person that by the time I moved from the waiting room to, the emergency room itself or whatever, there's one other person that got confirmed positive.
Okay, but that's not where you got the COVID.
Absolutely not. No.
Okay. All right. So,
all right. I will say, as far as the mask goes, I talked to a lot of people there and a lot of healthcare workers, and all of them said, even the one that I talked to that had COVID twice, all of them said that people none of them knew of any coworkers that had gotten COVID in the hospital because they're all wearing N95s.
Okay.
So, I know that it's still possible that you can get COVID with a mask, but
it's much harder. Well, it's much harder. I mean, it's much harder because you've got most of the people in there wearing it, so you're protected on both ends, at least, to a large extent. And but okay, So the N95.
Well, and one more thing about the emergency room. The only there were 5 people in there that did not respect the masks. 5. One of them was a guy that was on a bed that they had wheeled out into the waiting room, who was screaming in agony for much of the time he was in there. And I guess he had bigger issues going on than me. He was just in a lot of pain. There was another person who's, from what I gathered, whose boyfriend had just been shot.
All right. Well, listen, I don't want to, but we have limited time here, so I want you to get to the parts I'm not going to like.
The three people that did not respect the mask were the 3 COVID positive people. They were not respecting the mask. Right. Everybody else basically was respecting it. That's all I want to say.
Okay. All right. Okay. So, all right. So now you've had COVID now for, you caught it on the 17th. You have, it took how long to incubate? How long until you saw symptoms?
Well, when I went to get tested, they thought that I had the flu because it came on so quickly. But the reason I guess it came on so quickly is because I got so much of it.
Okay.
So I first came in contact with it Friday night around 8:30. Sunday, I really didn't feel great. I was supposed to go to my dad's. I didn't because I did not feel good. Good thing I did not.
Yep.
Monday, throughout the day, I was working. I worked from home. I was working, and just throughout the day, I was like, wow, something's really not good here. And then by 3, 4 o'clock, I was thinking I should get tested. By 5 o'clock, I was trying to get tested. I got a positive Tuesday morning at 10 a.m.
Okay. And so, and it sounds like it's just been a nightmare for you. You've lost 9 pounds over the course of, since last week.
Yeah. And really that 9 pounds was gone from Monday night at 9:30 when I was going to eat, but couldn't, until Friday, maybe a little afternoon. So, jeez.
Okay.
Yeah.
All right. So what's the part that I'm not going to like outside of like feeling bad for you? A, that you've got this, and B, that, I don't know what your reason for not getting vaccinated was. You want to tell us that?
Yeah. So, I mean, as you say a lot, and I know you're going to say, what else do you need to know? As Joe Biden said, what else do you need to know to make you get vaccinated? Well, I was being very careful. I was doing everything. There are people out there that are vaccinated that are much bigger risk to others than I am, or was, or whatever, have been. I just, don't feel like, and as you say constantly, there's a lot of unknowns with COVID itself, and people don't seem to understand that. There is unknown with the vaccine as well. And I kept trying to call you actually prior to getting COVID to have this conversation, and then I got COVID, which is hilarious.
Right. But, sort of better that you didn't. It feels like now. I mean, well, let's put it this way. Let's put the knowns about the vaccine that we know and the knowns that we know about COVID. We know the vaccines have not, it's conceivable to me that we've had a couple of people die from taking the vaccine. It's conceivable to me.
Right.
We know that there's been hundreds of thousands. In fact, there's no reason to limit it to just the United States, to 675,000 in this country, because the vaccinations have been taking place around the world. We're talking about 100. We're talking about a billion doses at this point, is it? Mm-hmm. So we have nothing even remotely close in terms of a death. We also know nothing remotely close in terms of illness like you're experiencing.
I understand.
We know that there is within a year and a half, we have data, or 2 years out in terms of long COVID, that things last from there. We know that there's no great incidence of adverse reaction. In fact, the other day we played a clip of Sam Harris who said that there, was maybe there was an argument about myocarditis in a certain cohort of boys, young males, but it turns out, according to a New York Times paper, I should say piece from September 1, that that there is a myocarditis risk. There's a greater one with COVID of myocarditis. So, I mean, those are the knowns and unknowns that we know. We also know that there have been people who have been studying at least mRNA vaccines for a long time. And so it's conceivable that there's $6.1 billion vaccine, 6.1 billion vaccine doses worldwide. Now, different vaccines, et cetera, et cetera. So maybe tough to say, but, we're a year out from people taking the vaccine for the most part, maybe 9 months in this country. There's a lot of information out there in terms of its safety.
I understand. With that said, while the mRNA vaccines have been studied for a while, this particular whatever coating or whatever it's called with that spike protein has not been studied for as long.
Okay, but let me then ask you this.
Please. So I'm not saying that there is an issue with it. I don't know if there's an issue with it. I've read some things that there may be issues with. I don't know. Those things are immaterial to me. What is material to me is that long term, nobody knows. So I was being very, very careful. I ended up getting it. I ended up getting it the only way I was ever going to get it. So I guess what I wanted to call to say prior to getting COVID, which is still very important to me, is that if they want people to get vaccinated, if the goal is the highest possible vaccination rate, then, if you would hope to get as many people vaccinated as possible with consensually, right? You would prefer that to be how it happens. So with that in mind, and with the promise of the manufacturers that, to put the health of Americans, the health of recipients first, and to get as many people vaccinated as possible, it really bothers me that, the entire thing is being put on people, not the people that are, and I understand some people have very dumb reasons for not getting vaccinated. I understand all that. But the idea that it's all on them when the manufacturers will not forego the waiver of litigation or financial responsibility for their product, when they're out there telling people, this is safe, this is safe, this is safe. What else do you need to see? This is America.
What about the J&J, dude? Hold on. I'm sorry. You said the mRNA ones. Why not the Johnson?
I should also say, just mRNA has been used. I know for a fact that mRNA has been used in cancer treatments for a long time.
I'm not debating that mRNA has been used or not used for a long time. What I'm saying is that with this specific spike protein,
there's a different vaccine.
Has not been done for.
But why didn't you take the J&J?
And honestly, at this point, I can't remember my reasoning for not taking it. But
all right, well, dude, listen. Hold on. No. Listen.
Not about the vaccine.
Listen. You're talking about the liability, and you're talking about. There's a couple of things that I'm gonna tell you now. The mandates are effective. More people are getting vaccinated. Okay?
Well,
and that's just a fact. That's just a fact. The other fact is, from a public policy perspective, you can't subject these companies to this type of litigation, or they won't produce it.
Well,
now
give it to somebody that will.
No, that doesn't happen, dude. Go look at the Lyme disease. Go look at the Lyme vaccine.
All I'm saying.
No, wait. No. You're not having to listen.
Contradiction there.
There is a secret vaccine court where people go and they get remunerated if they have adverse reaction, because there is no vaccine that has ever been developed where people don't have adverse reactions. On Friday, after that segment with Andy Kindler, I went and I got a shingles vaccination. My arm is still, people can see the red lump on my arm. I know people who've gotten that thing and it knocked them out for 2 days. They wouldn't get the second one. There is no such thing as what you're talking about.
I'm not. You're acting like I'm saying that I want it to be 100% safe. That's not what I'm saying at all. I understand that there's always going to be issues with any drug, any food, anything like that. Somebody's going to have a bad reaction to it. That's not what I'm saying. And the fact that nobody's bringing this up, because I guess the idea is, well, they're never going to do it.
Bringing up what? Okay. What have you said that nobody...
That if they want people to feel confident taking the vaccine, they want people to feel confident in that, then they have to show that they themselves believe it to be safe.
Dude,
they are not willing,
it is not. They don't believe it is 100% safe, because nothing's 100% safe. So what is the payout?
So are you saying that?
What is the payout?
Are you saying that then is it safe enough that the billions that they've made off of it, that after, even if they forego the litigation waiver, is it safe enough that even if they forego that, with the billions they've made off of it, that enough people are going to sue them that it's going to be a
What's the payoff?
Negative?
What's the payoff for, I don't know, let's say, I don't know, there's been 6.1 billion, I don't know, I mean, how many doses there have been of the specific vaccine that you have an issue with? But I don't know what the numbers that are breaking down. But I mean, the liability thing, you're not taking that. Have you never, do you know there was no liability for the shingles vaccine? That's the exact same dynamic. Do you know every vaccine you've ever taken has the exact same dynamic? You know that, right?
Well, there's a vaccine court, right? But you can go to the vaccine court for the...
It's not part of our normal legal system. There's not part of our legal system. It's a completely...
But you can't go to it for COVID. You can't go to it for the COVID vaccine.
I don't know that it's been set up at this point for the COVID vaccine.
No.
But you're telling me that the reason why... Wait a second. You're telling me the reason why people will go and take every other vaccine, but not the COVID vaccine, is because they don't... Because the COVID vaccine hasn't been signed up in the secret vaccine court?
I'm not painting with that broad of a brush. What I'm saying is that there are a lot of people that are not vaccinated. There are a lot of people that are not vaccinated that would get vaccinated if they saw that signal come from the...
Send me a link to that data. Send me a link to that data, because you know what? I bet you, even in this audience, even though I've mentioned this court multiple times that's outside of our... They don't even know it exists, period. The number of people in this country who are aware that there is a vaccine court, I literally think could fit, maybe not in this office, but is so infinitesimally small relative to the number of people who have been unvaccinated. We are the least vaccinated country in the industrialized West. The least.
Okay. All that's all
Dude,
I'm saying.
You just got to accept you made a mistake.
I don't have to accept that because I don't know that yet. Now, it's very possible that
you just lost 9 pounds.
I don't know that yet.
In 3 days.
Yeah. Well, yeah, I lost 9 pounds in 3 days. But if here in 4 or 5 years something pops up, people are more prone to other kinds of infections, something like that, something like, who knows? I don't know what it could be. I don't even want to get into what it could be.
I mean, don't you have these concerns about other medicines? Don't you have this concern about COVID? How do you not have this concern about COVID? We have data that shows that what it does.
I've been so careful. That's why I have been so
But it wasn't enough.
But dude, I got news for you.
It wasn't enough.
You weren't careful. You weren't.
I was careful.
No.
Yeah,
I got news for you. Not that careful.
I got news for you. You don't know. So
just listen,
I was careful.
dude. I know you hooked up with somebody who was not careful.
Exactly. Right. And I could have been more careful there, obviously, but I've been very, very careful. So now, what else do I want to say? Yeah. So real quick, with the hospitals filling up, absolutely 100%. That is an issue of people being unvaccinated. 100%. Not arguing against that. However, one thing that nobody's talking about that I figured out in what I've gone through is that another reason they're filling up is because if you're COVID positive, nobody will treat you. They send you to the emergency room. Now, maybe if you have a primary care doctor, which I don't, but if a doctor, this is just from what I experienced, if a doctor is the one that you test positive with, I don't know, maybe they'll treat you something, but I got tested rather, at a independent site that's not necessarily attached to immediately being seen by
and then you call up the doctor and say, I've got COVID. I don't want to be treated. I mean, I want to be treated for my COVID. And the doctor says, you can't come into this building because we're afraid of getting COVID.
Well, not just that, but we won't even come out to even the doctors that I have seen in the past that know me and I'm not primary, or they're not my primary, they would not even come and deal with me on the phone or
Right. You got to go into a situation where they have protocols for dealing with somebody who has COVID. Now, I agree with you. I agree with what you're saying, that the numbers in the hospitals, the reason why we're getting backed up is because people are afraid of getting COVID.
Well, it's not just that. It's because our system's complete trash. It's because,
Dude, listen. I'm sorry. Our rate of vaccination in this country is so abysmally low relative to other countries with far better healthcare systems. Now, it's possible that maybe in a country with a better healthcare system, you have developed enough relationships where people trust the vaccination protocols of the government. That's possible. There's really no way to really assess that, but it's possible. And I agree with you. Our healthcare system is garbage. But I got news for you. I've been working, I'm a doctor, and I've been on the front lines of COVID for a year and a half, and I'm watching this shit. And you call me up and say, I got COVID bad. And, I hooked up, but I thought she was safe or he was safe, and I didn't get vaccinated. Can I come in so you can treat me? You know what my response is? You got to be fucking kidding me. I got kids.
I'm sorry, your response is what? Oh,
you got to be kidding me. Well, I got kids and this and that. And we've had a vaccine out here for 9 months.
You're really putting some words in my mouth. I was not trying to enter into the building. I was trying to have a telehealth appointment, which they do. If I had tested positive with a doctor, they may have treated me telehealth. But if you don't test positive with the actual doctor, my experience was they tell you to go to the ER. It doesn't matter if you need to go to the ER or not.
Sounded like you needed to go to the ER.
No, this was after I'd had the antibodies.
Well,
right? This was after I'd had that. So I was much improved. I'm still a far way off from being back to anything like I was, but I was, not. My oxygen never got messed up. My biggest concern.
All right. Well, listen. Yes, you should. Someone should be seeing you on telehealth. No doubt about it.
Right.
I agree.
And
but
filling up.
But I mean, let me tell you something. Honestly, all these ancillary things. I honestly, I hope that you have no complications down the road. I hope that you get better soon. But I got to tell you, man, I can't. I think you are a good example of somebody who has a position, and there is no amount of facts that is going to inhibit your position on this. You may be right. maybe it's not even the vaccine. Maybe it's, maybe it's my sports drink. Maybe it's LASIK surgery
like,
30 years from now.
You're talking to me like, have that I think they're 5Ging us or something like that.
But
That's
you know
not
what? Honestly, dude, you sort of are.
No.
You're not coming up with what the 5G is, but you're telling me that it's possible 5 years from now, billions of people, or maybe just hundreds of millions of people. You're not saying millions, because if it was millions, you would just do the math and go like, oh, wait a second, millions have died of COVID already. So it's not millions. You're telling me that 5 years out, there's enough of a chance that tens of millions of people are going to die because of this vaccine, that it warrants not taking it now. That's what you're telling us. And I got to tell you, dude, that is a click away from the 5G.
Eventually.
Huh?
I fully intended on getting it eventually. I was just being very careful and waiting.
Well, I think you waited too long.
Yeah, maybe I did.
I mean, because you listen, there's a lot better chance that 5 years from now, we're going to be reading stories. Child incidences of child diabetes is up. Kidney failure is up. Autoimmune systems are broken. Neurological problems. With those numbers that I just mentioned, it's a lot more likely that we're going to see that as a fallout from COVID. That's just the facts. It's just an odds game, but we like double the number and they don't have hard data on this yet. All they know is that there's been double the reported incidence of child diabetes. And they're looking into it. Maybe it's a function of kids aren't going out as much, maybe because of lockdowns. But as they dig into this, they're starting to see like cells in the pancreas that have nothing to do with just sitting around. I mean, there's a lot of stuff out there, and I feel bad for you. I feel bad that you got COVID. I don't think you deserved COVID at all. And it does sound like you were trying to be cautious. And yes, I understand the dynamic of like, it's like everybody's living in their own private pandemic, and you have to, trust people, and you still want to go on with some elements of your life. But dude, I'm telling you, the speculation that you're talking about, that 5 years out, there's going to be this adverse reaction that is going to be greater than COVID, and it's going to have to be amongst millions of people. That's just a notch away from the 5G. You're just basically calling it, 5X. You don't know what it's going to be, but you think it's something, and there's no basis.
I don't think it's something. I think it's possible.
Yes, it is also possible that there's a meteor that comes in and knocks out more people.
Okay, well, I weighed that possibility against how careful I was being, and
you were wrong.
Not necessarily.
Yeah, no.
Not necessarily. I did get COVID, but I'm not necessarily wrong.
Well, listen, you know what? It's possible that by taking this phone call, going 7 minutes over, that my schedule gets pushed back 7 minutes, and I miss getting hit by a car. And you know what? You and I will never, ever be able to prove that that's not true.
Well, you're welcome.
And so all I can say is thank you, dude. Hang in there. I honestly hope that you recover quickly and that you have no after effects. But the chances of you having those after effects versus the chances of me having any after effects from the vaccine is greatly, greatly in favor of you having after effects. And I say that with the only reason why I say that is so that people can listening, understand that, because that is just simply every ounce of data that we have, every bit of medicine and knowledge from researchers that we have who have been working with mRNA technology for 20 years, epidemiologists and scientists, the overwhelming majority of them would agree with what the statement I just made. hang in there, man. I appreciate the phone call. Email us and update us, okay? And let us know when you're feeling better. You know, I understand all of it. You know, I go through it. I got 2 kids. I got, you know, I have an ex-wife. Like we all, you know, like everything's got to be negotiated. Everybody's living in their own private pandemic. It's hard.
No,
It's hard. But there is 2 things that you can do that have definitive value. Mask in as many situations as you can. Be vaccinated. You know, I feel horrible for that guy. I really do. And, you know,
Look, I mean, I feel horrible. I know people like this in my own life. A little more, like, very anxious about this. Sometimes anxious more so about other things. And, like, it's not rational. That's all I got to say. And I feel for you. I love people, you know, who also suffer from some of that stuff. And I get it. I'm sorry, man. I'm sorry you're going through that.
And, you know, I wish we had been more convincing about the vaccines. I mean, it really makes me feel bad that there are people who listen to the show that we didn't do enough of a job in convincing about. I mean, everything's a risk. Like I say, I could, you know, that phone call could have saved my life because I'm not going to get hit by a truck. Or I could get hit by a truck and maybe it's that phone call's life. I mean, both those possibilities exist. It's impossible to measure. Right now, we have facts.
Tune in tomorrow to see if Sam shows up tomorrow.
We'll see. We'll see. But right now, we do have a set of facts. And, you know, we have a set of facts. And I can assure you that all of those people who work in those pharmaceutical companies, they've all taken the vaccine.
The rationality is not based on facts. I mean, this is just our brains are can convince us that we're being rational when we're really just trying to like rationalize our anxiety, right? But the reason it was revealing when you said, "I don't know why" about the Johnson & Johnson.
Folks, there's more of what you've just saw where that came from. That's if you hit the subscribe and like button. Thank you. Really, thank you.